Okay. We have everyone in, we think?
Yeah, yeah.
Okay. Well, good morning, everybody. Thank you for taking your time out of the day to join us. Welcome to today's webinar on the Community Behavioral Health Agency's CBHA Toolkit. I'm Blair Gaston, the Marketing and Engagement Coordinator for the Washington Alliance for Quality Recovery Residences, or Walker for short. I had the pleasure of putting together the CBHA Toolkit for Walker in partnership with the Healthcare Authority of Washington State. And through my work, I gained a wealth of knowledge. However, I'm no expert in the field of behavioral health agencies, but I have worked closely with CBHA providers and stakeholders to develop this toolkit. And so we are really excited to share the final project with you today. In this webinar, we will explore the benefits of CBHAs and how they can help provide coordinated, comprehensive behavioral health care to individuals in need. And we'll also discuss how this CBHA toolkit can assist you in the process. I believe we have the link to the toolkit in the chat posted now. If not, it will be there any minute. If you want, you can follow along there, but every single thing in the toolkit is going to be in this presentation, but you can just save it, download it to reference it later because there's tons and tons of useful links that we'll be going over. And then also later on in our presentation, we'll have a guest, Milena Stott, to talk to you guys a little bit more in depth about a couple of the topics. So if you have any questions, you can put them in the chat and we can answer them. And yeah, let's get going. So did you know that Washington State has over 100 CBHAs that can provide critical behavioral health services to individuals in need? This toolkit aims to provide information and resources to recovery residence operators seeking to partner with CBHAs that offer Medicaid-reimbursable services in accordance with the SERI guide, which is the Service and County Encounter Reporting Instructions Guide. I also found when I was preparing to present this toolkit that every time I said SERI guide, my laptop would like chime in. So I had to disable that. So hopefully that doesn't happen to you because we will be referencing the SERI guide throughout this presentation because that's where all the codes and everything that you would need are found when trying to have your services reimbursed by Medicaid. The SERI guide helps people work with mental health care, report their services accurately, and they have instructions and rules about when and how to report services. And they use certain codes to describe them. The SERI guide, it talks about different programs and services and what's available for people with mental health needs and who is eligible for them. Everyone in the state of Washington can get help for mental health crises and involuntary treatment services, no matter of their income. And some of the codes used, they're owned by different organizations, but they're all updated regularly. And the SERI guide is linked throughout this as well if you'd like to click on it and see what it is that we're talking about. But let's get into some background information. The social model of recovery is foundational to all recovery residences. It's guiding the domains and principles of accredited recovery environments and distinguishing them from other shared living environments. It emphasizes an experiential mental knowledge gained through recovery experience and residents supporting each other through giving and receiving help. The concept of a psychological sense of community derived from the community psychology is important in highlighting the feeling of connectedness and group membership among community members. These principles contribute to a supportable and empowering environment for residents in recovery. It helps them to maintain their sobriety and also transition back into independent living, because that is the goal in recovery residences. We don't want you to need to stay there forever. We are about getting you back into independent living and stable on your own. So recovery residences, they offer safe and supportive living environments from people recovering from things like substance use disorder. These homes encourage personal responsibility, self-sufficiency, and sobriety. And residents actively participate in their own recovery, and they have access to various support services and resources. And that's what we're going to be talking about today. Recovery housing allows for continued time in recovery in a supported environment following their effective treatment options from their substance use disorder or mental health. Living in a community in recovery housing with support from others in recovery is considered a critical component of success. The public and policymakers have become more aware of the devastating effects and costs of substance use disorder in the United States in recent years. And since the 1970s, many people in recovery have established recovery housing type residential environments that provide people in recovery from SUD a safe, alcohol, and drug-free place to live. But recovery housing varied in quality and options for care. And in 2011, a group of sober housing operators created a code of ethics for recovery homes. They formed the National Alliance for Recovery Residences, known as NAR, and they established this national standard for recovery residences. The standard defines the levels of care in recovery-oriented housing and the services, and defines 4 categories known as the levels of care, or also known as levels of support. The NAR standard, it guides certifying effective recovery residences, and it incorporates the social model of recovery with the levels of support in the house. And yeah, coming up in this presentation, I'll let Milena tell you more about the levels of care, because your understanding of that is vital in your decision making for that question of, do I want to enter into the behavioral health agency role, or am I better off partnering with one? So as you might have guessed, Walker is the Washington affiliate of NAR, and we provide a network of safe and effective, high quality recovery residence providers for individuals recovering from substance use disorder. Our mission includes maintaining quality standards, certifying and publicizing recovery residences, like on our registry, which is linked at the bottom, the recoveryhousinglaw.org. We're also interfacing with neighborhoods and government and other agencies, and providing resources and trainings like this one for our resident operators and the general recovery community. We do have recordings of our past training events, and also a calendar for upcoming events is available on our website at walker.org. Also, Walker accreditation would get your level 2 residence on the state registry. And you might be asking, why would a housing provider want to be listed on the registry? Well, the registry will allow housing providers to apply for funds and from the operating capital revolving loan, and also future funding opportunities could also be dependent on Walker accreditation. So Substitute House Bill 1528 passed in Washington State in 2019. It recognizes substance use disorder as a disease impacting families and society, and it emphasizes the importance of a system of care that includes prevention, treatment, and recovery services. Access to quality recovery housing is crucial for helping individuals remain in recovery from SUD and then beyond treatment, and benefits both the individuals and their communities. This act addresses the quality of recovery housing in the state of Washington by recognizing the potential for fraudulent and unethical recovery housing operators, in addition to the lack of affordable housing nationwide. And when this House Bill 1528 was passed by legislature in 2019, it went into effect January 1st of this year. It included a provision that actually requires all SUD providers, when referring clients to recovery housing that they can only refer to housing listed on the state registry website for recovery housing. And there's a link there for that as well. The state registry is ran by the Healthcare Authority. And now with the background information out of the way, we'll begin getting into the toolkit. So this toolkit is going to assist those in the beginning process of deciding what type of recovery residence they want to operate, and how to secure funding and other vital resources. Operators can either partner with an existing CBHA or they can become one. So what is a CBHA? Community behavioral health agencies provide comprehensive behavioral health care services to anyone who requests care for mental health or substance use, regardless of their ability to pay, age, or where they live. They promote a recovery-based focus to services, with SUD treatment providers working collaboratively with other healthcare providers to address the needs of individuals seeking care. And recovery-focused attention is given to SUD prevention, assessment, and treatment in all services provided by CBHAs. Some of the possible Medicaid-reimbursable services in recovery residents include the assessment, case management, outpatient treatment, brief intervention, financial debt and management coaching, career preparation, spiritual counseling, peer services, and recovery support services. So all these things you could be billing Medicaid and getting reimbursement for. Recovery support services can also include, but are not limited to, transportation to and from treatment or recovery support services, employment services and job training, relapse prevention, housing assistance services, family, marriage, education. And if you want to see if you want to see the reference for this, the WAC down at the bottom is linked, and you can see all of the certifications that are required there. A partnership is defined as a group of leaders or organization that use an inclusive strategy to establish their shared goals for the community and then agree to use their personal and institutional resources to achieve them. So why is partnering essential? In this case, a partnership is a formal arrangement between two or more parties working together to support a person with SUD and recovery housing. So community partners aid in utilizing these community resources that are available. Because if we fail to support our residents and we leave them to navigate this complex community resources alone, or just assume a universal approach to their recovery, we fail. Partnering is essential because partnering with other organizations is crucial. No one organization can provide all the necessary services for recovery, services and resources for recovery. Like, the residents have diverse needs, and they offer a range of service options and formats that are required to address them effectively. Recovery should address the whole person, including the physical, emotional, and social needs, but no one organization can specialize in everything. So that's why we have to partner. Recovery requires a variety of solutions and options, and partnerships with other organizations can provide access to those resources. By focusing on our strengths and leveraging the expertise of offering and following through with these partnerships, we can better support our residents' recovery. Collaborative care is essential for individuals in addiction recovery. And the community agencies all come together and provide a coordinated care and offer resources. Coordination among providers can prevent stress and reduce the risk of relapse, as well as improve efficiency and use of resources. Partnering with different agencies can promote compassion and equity in healthcare, leading to better outcomes for all. And then collaboration, it fosters new and innovative recovery strategies without increasing costs. It also offers diverse perspectives, which end up leading to more creative ideas. Multiple experts are needed to improve overall service and resource quality for individuals in recovery, and community partnerships provide access to those experts and their expertise. Effective outreach to community partners requires identifying staff members to lead the effort. So, your first contact with a potential partner should typically be via email or phone because you want to inquire about the appropriate individual that you need to reach out to. And in your initial contact, just include a description of the residents and then your resident needs. Outline your objectives for the potential partnership and a request for an opportunity to discuss ideas further. Site visits and invitations to join team meetings are like standard procedure for building relationships with community partners. They want to see what you have in the place that you're running, and you also want to see what they have in the resources that they have available. It's essential to be proactive and informed with proposals, with your questions and suggestions for next steps to ensure that your outreach effort is being successful. When identifying your potential community partner, think about what are the needs. You can survey residents and staff, and you should consider the whole person care domains. Define your objectives. What do you hope to achieve with this new partner? How do you envision this partnership being mutually beneficial? And consider your residents' capacity for contributing to a new partnership. When you do identify potential partners, utilize staff and resident knowledge of available resources. These are 3 different websites that can aid you in your search. And then the next step is just to evaluate the potential partners that we've identified. So yeah, those are linked in here and also in the toolkit. And we'll also be sending you the slides after this presentation. So if you see a slide and you want to go back to it and click on a link for a resource, that will be available to you later. But yeah, when you are evaluating your potential partners, this is just a list of things that you should think about, like your ideal partner profile, which is just a description of a partner that would benefit most from participating in your partner program. So that might include their locations. Are they nearby? Do they have more than one location? And what services do they provide? Think about referrals and the size of staff. Do they have enough staff to effectively provide services to your program? And then think about the agent's history. Like, what's their track record? Are we looking at 5, 4, 3-star reviews here? Because they're probably on Google. Does this partner even fit the needs that you have? Does their mission and philosophies align with your residents? Are they in good standing in the community? Like, how are they perceived? And when you visited, do they provide a welcoming environment for those in recovery? Is their staff experienced? What's their eligibility? Are they at capacity? Are they accepting new clients? What are the costs of services? What insurances are accepted? These are just things to keep in mind. I see a question in here. I just want to pause and answer. It says, you mentioned that you should survey residents. How do you do that? Meaning how to find residents. So when we are talking about residents, we're talking about surveying our residents that we already have living in our recovery residences, and just finding out what their needs are, so that when you're looking for a community partner, are you looking for something, which I'll get into later, but like a FCS program or employment services? You need to identify like your residents' needs to know what type of partnership can benefit both you and them. I hope that answered your question. Thank you. Okay, and then on to our next slide. So to work better together, organizations can choose a partnership coordinator or a point person. This can help ensure effective communication and coordination. Establishing communication and referral protocols, as well as working on mutually beneficial projects, will also strengthen your partnerships. Regular communication and support, as well as addressing issues during meetings, is essential for maintaining successful partnerships. Also, introducing partners to staff and residents and celebrating successes that will also boost your partnership and a positive relationship. Developing a plan for handling problems or disagreements is critical to managing any issues that may arise. And also showing appreciation for your partners through newsletters or social media and your website with permission is also a great way to recognize them and thank them for their contributions. Despite the benefits of partnerships, there are barriers that can hinder their success. So let's talk about those. The barriers can include a lack of interpersonal skills, staff turnover without warm handoffs, and like a lack of mutual benefit for both organizers or organizations. Unresolved grievances or adverse experiences can also create obstacles. And then the apprehension and stigma against those in recovery can further impede effective collaboration as well. And also limited referrals and benefits for residents' needs can also hinder the partnership and prevent them from achieving their full potential. I mentioned a little bit FCS a moment ago, but FCS stands for Foundational Community Supports, and that is a program in Washington that provides housing and employment support to vulnerable Medicaid beneficiaries. The program's goal is to promote self-sufficiency and recovery for its participants. FCS helps find and maintain stable housing and employment, providing supportive services to assist with these efforts. And then supportive housing services help with obtaining and keeping community housing, while supported employment services help with overcoming barriers to employment. FCS is a partnership between the Healthcare Authority of Washington, the HCA, and the DSHS's Aging and Long-Term Support Administration and Mayor Group. FCS works with a network of agencies that provide evidence-based supportive housing and employment services. And these services provided are person-centered, and they match the individuals with the right environment that'll help them achieve their goals. FCS also collaborates with employers and property owners to create a supportive environment for individuals to succeed. So it's really great stuff for our residents. Here is a provider map from the Healthcare Authority's website, and you can see the different FCS providers in here. You have the supportive housing services and the supportive employment services. And so if you would like to check out the map for yourself, this is a link when you go through it later. It's also linked in the toolkit as well. So let's get into a little bit more about supportive housing services. That is a service that helps the homeless or unstably housed individuals that live independently in community integrated housing. It includes activities such as skills training, cueing, modeling, and supervision based on individual assessments. The FCS benefit can provide funding for services in each unit designated as supportive housing if eligibility requirements are met. And then the image here is a screenshot from one of the pages in the toolkit, and it just shows you the different requirements here for supportive housing eligibility. So you can take a look at that. And for this one, the image as well, but this is for supported employment eligibility. So supportive employment is a service that the FCS, that helps FCS eligible individuals find and keep community employment. Activities are designed to ensure successful employment outcomes through person-centered methods like skills training, supervision, and other support. The service providers individualize support such as identifying career goals, developing relationships with potential employers, and assisting with job interviews and ongoing support to maintain employment. This slide highlights the key benefits and the requirements of the FCS benefit for supportive housing and supportive employment. So it just emphasizes that tenants receive various support services, including assistance with budgeting, accessing benefits, and eviction prevention. And then providers can also access additional funding for tenants who need extra support and must adhere to state and federal guidelines while providing these services. How can providers participate in the FCS program? The state has contracted with AmeriGroup Washington to be the third-party administrator to select, qualify, and contract with employment and housing providers. AmeriGroup provides services intended to help Medicaid beneficiaries with complex health needs transition to and maintain community placements. AmeriGroup will also authorize FCS services and reimburse providers. And then if you are interested in this, after this, you can contact AmeriGroup directly, and there's the contact information there. And then we've also provided a FCS provider application just for you to go over and reference when making a decision. And at this time, I would like to introduce Milena Stott, if we can get you on here.
Hi, Blair.
Hi.
Hi, everybody. Milena Stott here. I am a licensed social worker and drug and alcohol counselor, and I also do outreach to rural communities across the U.S. in support of building recovery housing. I'm a resident here in Washington. And I work closely with Blair and the team over at Walker as a board member. And so I've also supported a lot of the work here in Washington. I've worked in the behavioral health agency space, and I've also opened residential treatment centers and helped certify services on the agency side. And so I'm happy to be here as a resource to talk to you all about what that looks like in relationship to your decisions around recovery housing. And do you partner with the behavioral health agency, or do you move forward to go ahead and deliver those services yourself? One thing that I like to say before I start off is that the most important answer, or the most important element in decision making around that question, is really around who you're serving and what they need, and how you're able to serve them. In many ways, we want to design services and create environments that support the needs of those that we serve. So I think that the foundation to that answer is first being able to understand who you're working with and what they want in terms of support, as well as what they need. All right, next slide, please. So when we talk about the populations that we serve, different people have different levels of need, and their levels of need also changes through the course of their recovery. And so they may start with higher needs and reduce their needs. They may start with lower needs and have, a life event that requires additional support. So while we talk about these levels, in a linear way, they're actually fluid. And the services and the way that we respond to the needs of the people that we serve, follow that fluidity. So we're going to go into detail kind of over the next slides around what each level means. But really, when we look at the classification system across the levels, you're looking at the level of administration and staffing. You're looking at the types of services. You're looking at the residents and the structure and size of the residents, and then you're looking at the staff and who's delivering those services. Next slide, please. So in the guide, we have this kind of little decision tree to help you understand the levels in relationship to the certification process and the resources and guidelines around certification. So a level 1 house, in Washington is an Oxford house, and it's a nationally recognized model. And so it's essentially grandfathered into that registry and follows this recipe. And, that level 1 structure of the Oxford house also aligns with the levels that, NAR has outlined. When you move into level 2, you have a staffing at the home. And so once you have that staffing, you can decide, what your eligibility is to become a BHA or an FCS provider or deliver some of those services as a level 2 home. One of the things that I like to tell folks, especially those that both serve and house people with needs, is that when the housing or the service doesn't work out for somebody, they're often left without both the housing and the service. And so I think that that's, one of the considerations that you have to look at is that if you're delivering both the service and the housing, how are you supporting those individuals in their transition when one of those things isn't working out? In Washington, level 3 and 4 puts you at the level of a residential treatment facility where there is licensing and oversight by the Department of Health. So in addition to getting licensed for the behavioral health services themselves, there's also some regulations around the structures of what has to happen within those facilities. Walker looks at the structures of the level 2 homes. But it's the Department of Health that ultimately decides the certification and licensure for the level 3 and level 4. And you can see here in this decision tree as well that you basically have to follow a different set of Washington administrative codes in addition to the Behavioral Health Agency certification requirements. All right. So kind of going into those levels, right? What's happening in each level so that you can make this informed decision about who you are and what you should be. So in a level 1 house, that's your Oxford house. So Oxford houses in Washington are eligible for housing vouchers. They are peer-run homes where individuals stay an average of 1 to 24 months. We have heard individuals needing to stay longer in certain settings because of lack of affordable housing in the pipeline and, long waits for affordable housing. And then other folks choose to stay longer because they need to continue to have that shared and supportive environment and community to maintain. They just don't feel like they're ready to go out on their own. There are urine screens that are done in these homes as well as house meetings. They're typically family residences, and there's no paid positions. It truly is a democratically run community with a democratic process and policies and roles around, the actual operations of the house. Most people aren't ready to leave, intensive inpatient and drop straight into an Oxford house, especially given if you need support around relapse and recurrences. That, in those situations, you're going to want to find yourself leaving residential to a higher level house. Sadly, sometimes it's really based on availability. I mean, we'd love to get to a place where, the need and the choice and all those things kind of align in place. So when you're looking for a more supportive environment, that is the intent of a level 2 house. A level 2 house has a staff position and peer services that are happening within that house. They are also eligible for a housing voucher. The length of stay in these homes are a little bit longer because folks need that additional support. And so they need that, instead of the range of 1 to 24 months, they're more likely going to be there for about 6 months. There are house rules, there's urine screens, there's in addition to the peer services, there's often life skills coming into the home, sometimes on a voluntary basis, and sometimes through other arrangements made within the community. Sometimes these level 2 homes are apartments or other dwelling types with access to those supportive services nearby. And the key differentiator between a level 1 and level 2 is that there is one paid staff. In these level 2 homes, they're either partnering with behavioral health services or other services in the community. And we also have some individuals that are becoming licensed for, other services or looking to become licensed as a FCS provider, for example. All right, next slide, please. So with level 3, this is your ASAM, low intensity residential treatment services. It is licensed by the DOH, and within that license structure, there are outlines around service requirements. ASAM is actually updating their continuum of care. And so it'll be interesting to see how that plays out for residential treatment facilities. That story is going to be written. A big differentiator with a level 3 facility is you're actually subject to medical necessity criteria, and you're not eligible for housing vouchers. So in a level 3 facility, if you're going to get into that facility, you have to have a substance use disorder treatment assessment at a local behavioral health agency. There's one good reason right there for needing partnership. And then you have to request authorization from a managed care organization to place the individual there. And then at that point, that individual is managed through treatment plan reviews at intervals that are agreed upon and defined by the managed care regulations. The focus of the services are life skills, and there are also some clinical components to it because the assessment and the clinical services are driven by ASAM levels and WACs. Level 4 is a residential treatment facility as well. The stay is a little bit shorter in this facility, and similar to the other one, there are higher levels of clinical services and programming here. Again, you're licensed as both a BHA and a residential treatment facility by the Department of Health. There have to be credentialed staff, and again, you're also subject to medical necessity criteria. The services in the setting tend to be more intensive and of shorter duration. So that's typically what you see. The higher the level of care, the higher the intensity and the shorter the duration, because the expectation is that you stabilize and you kind of step down into the lower levels. So you can imagine that somebody from a level 4 may have a hard time stepping straight down into a level 1 after receiving, a significant amount of clinical support in a structured environment. They may also have medication needs as well that, get carried over into the recovery house space. And then therefore you need that continuity of care through that partnership with a behavioral health agency in some way, shape, or form to keep that individual at the level of stability that they came out with. So this just kind of takes us back to the toolkit, and you saw the decision tree early on. This is a little bit of a different visual. In this visual, we kind of tend to outline and define the characteristics of the differing levels of care and which ones qualify for housing vouchers and kind of like where the services stack up and which regulations define those services and how you go to seek information on what you have to do to meet those requirements. All right.
I think it'd be a good time to open up questions. If anyone has any questions for what we just talked about with you. If anyone wants to, you can unmute yourself if you have a question you want to ask about what we've covered so far. Just give a moment. Okay.
I have a quick question before we move on. Is anyone on here, wanting or considering becoming a recovery house or a behavioral health agency? Or, what inspired you to join us today?
I remember one of the last ones that we did, we had a couple of our current Walker accredited recovery residence operators on here. They were already running the recovery residences, but they were more interested in the different ways to get their Medicaid reimbursement. And I thought that was really interesting that, they can benefit from this as well. And but yeah, it'd be interesting to see if there's anyone on here who is having those same questions right now. Guess we're all shy. Okay. Well, thank you, Melina. Oh, here we go. We have a question. Keisha Thomas says, just curious, as my agency works with clients, but not in this capacity, but we have people that would benefit from a model like this.
That's great. Keisha, what is the name of your agency? Are you a behavioral health agency?
Kitsap County Resources Nonprofit.
Got it. Okay. So maybe you're doing some foundational community support services.
Yes, FCS Housing Hotel CHG.
Yeah, no, it's funny because in the permanent supportive housing world, they coupled, housing and services. And in many ways, that's what we're doing here in the recovery housing world, is that if we can couple folks with the right services and housing, they're able to stay in housing longer and improve. Right? If you give them just housing and not the services, they may have challenges achieving recovery goals because there's some other things going on in their lives that need attention, right? But if they have just FCS, and you're trying to help them find housing, if that individual indicates that they need to be in a environment that is supported by a community that requires an abstinence focused setting, then working with the registry to identify homes in your community, becomes important. So that's one thing that you can do as an FCS provider is you can become familiar with the recovery residences within your community. And so folks who are in a hotel and maybe are better placed in a recovery residence could get, access to that, and you free up the hotel for the folks that maybe haven't chosen that environment. It's about really finding what do people want, and what's the setting that's available in my community that best meets that want.
Wow. Well, thank you, Melina. If no one has anything else, I really appreciate you coming on. I didn't say this earlier, but I've had laryngitis for the last few days and my voice is recovering. And I was really nervous I wouldn't even be able to do this, but I'm very glad to have you here and I appreciate all your help today and actually help with building this entire toolkit. It would not have been done without you. So thank you very much.
Thank you, Blair. You're doing wonderful. I was really impressed with how you're describing the recovery house space, and I'm thinking of how there's a few folks I want to send that to and say, look how nicely this is done. So all your work and diving into the space.
Thank you. I've learned a lot creating this. So thank you. We're going to move on now to section 3. And in section 3, we're going to get into some of the most important information that is in this toolkit. The licensing services and requirements for BHAs to get the Medicaid reimbursement, and then getting your recovery residence Walker accredited. We'll talk about what that takes, and I'll introduce, we'll bring back Brianna, the Walker accreditation coordinator. And then after that, we'll talk about what it takes to be a BHA or a residential treatment facility. And we'll just go over the services, requirements, and the actual step-by-step process as well. The DOH is responsible for licensing and regulating both inpatient and outpatient behavioral agencies. BHA, licensed by the Department of Health, can become certified to provide mental health, substance use disorder, problem gambling, and gambling disorder services. And it's mandatory for a BHA to have a license and certification if it wants to get Medicaid reimbursement, provide court-ordered mental health or SUD services, or is mandated by state law. If you want to find out more about BHA licensing and certification, the DOH website is literally the best resource. I would suggest that you pull up their website in any of this, because it's just very easy to navigate to just get all the information. It's also all in this toolkit as well, but if you want to take a look at their website. The licensing requirements, they might differ depending on whether you're applying for a new license or renewing or even amending an existing one. And you can pull up all the forms and all the applications that are required for licensing on the forms and applications webpage. And then it has all the links and resources for submissions to the correct departments. The quickest way to check the status of a BHA license is on this facilities credential search site. And this one I would also click on and open up. The information is getting updated so frequently, though, that when I first created this CBHA toolkit, they had this thing called the Green Book, which is like a giant Excel document that I had to look at, and it was like confusing to navigate. But once I started building this presentation, I found on the DOH website, they have this incredible tool. It's the Green Book there, and you can click on that link as well. But it lets you select a county and then like the treatment or the type of service on a detailed map. But it's a really great resource, and it was brand new right after I built the toolkit, but that's why it's in here, because it's a great resource. Okay, and the fun stuff. All right, submitting policies and procedures. So if you're going to apply initially for a behavioral health agency license or certification, or even if you want to like add a new service, you're going to follow these steps. So fill out the BHA licensing and application, provide a community relations plan, and pay a required fee. Step 1. Step 2, you're gonna have to submit policies and procedures that comply with this chapter 246, 341 WAC, which is extremely important in all of this, which is linked as well, because you're gonna wanna know that pretty much inside and out when you are creating your policy and procedures. There's also a review tool as well. You can see the link to the PDF there that helps you create those. In step 3, you can obtain a drug or another controlled substance registration from the Pharmacy Quality Assurance Commission for like MAT services and MAT treatment. You can get, on step 4, get accreditation from a federally recognized accrediting organization. Step 5, obtain approval from the Federal Center for Substance Abuse Treatment or the federal DEA. And then once you've completed these steps, the DOH holds a public hearing in the community where your facility is supposed to be located. And then you'll have to respond to any concerns that are raised by the public by then submitting a community relations plan that addresses all of those concerns. And then, yeah, the slides will be sent to you. There's a question in the chat. The slides will be sent to you in a follow-up email, also with a survey later on today, maybe this evening. And okay, let's get on to, okay, just a reminder, again, if something that I'm talking about, you don't see a link for, it's literally all in the toolkit. And then as I'm talking about the slides, they have as many links as possible, but not everyone, but because that's what the toolkit's for, is full of links and resources. But these are just some PDFs that you would use for your applications and forms. So I just wanted to compile them in a nice place to find them. So BHA rules in progress. So there's a rulemaking project right now to modernize BHA licensing and certification requirements in Chapter 246, 341 WAC. And that's the current law in the rules in progress. But this just talks about, this slide just has links to talk about all the different behavioral health requirements and the laws that they're constantly updating and making better. So let's talk about opioid treatment programs, or OTPs. These are clinics licensed by the Department of Health and federally accredited to provide medication assistant treatment, MAT services. OTPs are a vital component to recovery residences. All accredited housing operators who are listed on the state recovery residence directory, they accept residents who are taking MAD or MAT. These are the 3 medications approved by the FDA to treat opioid use disorder. So some of you might already be familiar with them, but you have methadone, which reduces opioid cravings and withdrawal and blocks or blunts the effects of the opioids. Naltrexone, which blocks the euphoric and sedative effects of opioids and prevents feelings of euphoria. And then buprenorphine, that's a hard one for me, suppresses and reduces cravings for opioids. And then these are like the outpatient recovery support services that you can potentially seek Medicaid reimbursement for. Individual mental health treatment, brief mental health intervention treatment, group mental health therapy, family health or family therapy, rehabilitative case management, psychiatric medication management, medication monitoring service, day support, mental health service, recovery support, consumer run recovery support, substance use disorder, and problem gambling disorder. So all those can potentially, you could get reimbursement from Medicaid. Mental health inpatient services. These are ones that you can potentially get Medicaid reimbursement for as well. And so those include evaluation and treatment services, intensive behavioral health treatment, child long-term inpatient program, crisis stabilization unit services, triage, both involuntary services, and even competency evaluation or restoration treatment service. And then now I just want to welcome back Brianna to talk about Walker accreditation. I just want her to go over that for you because she is our accreditation coordinator. Brianna.
Hi, yeah, thanks, Blair. So I'm the Walker Accreditation Coordinator. So anytime you're going through Walker accreditation or reaccreditation, I'll be your primary point person helping you through the process. So as far as Walker accreditation goes, we do accredit all levels, but like Elena was saying and Blair was saying, level 2s are really what we focus on because the level 3s and 4s already have Department of Health licensure and they go through way more than what our Walker accreditation would go through. So we would still give them their certificate if they wanted it, but mainly we do accredit level 2s as what's on our registry, as well as level 1 Oxford houses. So yeah, some of the benefits of Walker accreditation is you're added to our registry, and then if you meet the criteria, you are also added to the Healthcare Authority registry. as well as certain funds are tied into Walker accreditation, such as the operating and capital revolving loans, as well as that referral mandate that Blair talked about in the beginning of the presentation is also tied into Walker accreditation as well. In order to be on the state registry, you must go through our accreditation process. So as far as how do I start with Walker accreditation, perhaps you're brand new to wanting to open up a recovery residence, or you have a recovery residence right now and it's not accredited. So the process would be going to walker.org. From there, there's tabs where you can learn more about the accreditation process. And then you can actually hit the apply button. So you could do that right away. And I really recommend that to people who are going through the accreditation process, is to go ahead and just dive into it. That way you could see all the documents and policies that we require. Another tip I always tell people is to actually print the Walker standards and have those handy, because we do base everything according to our Walker quality standards, which are on our website. So you'd estimate your level of care, you'd submit your documents from online in the application portal. From there, once it's submitted, I receive it, and then I would send it out to one of our document reviewers that we have throughout the state, and they would actually review all of the documents according to the Walker standards. We send a report back, so it's really back and forth communication a lot of times in all steps of the process. So if you don't meet a standard fully, then we let you know. We also let you know how to what areas we need adjusted in order to have you meet that minimum standard. Once the document review is done, we now do it on Zoom, a Zoom interview where we just get to know your organization, get to know some of the policies and procedures that are in the ground day to day in the home. And then the last portion of accreditation is actually the site visit, where we schedule one of our site inspectors to come to your home and just check for some safety things. We do have a checklist that will help you prepare for it. From there, once all of those areas have been met from the site visit, then we get final approval and we will post you on our registry. And then again, if you meet the criteria for the Healthcare Authority registry and accept medically assisted treatment, then you could be on the state registry as well. And that's just kind of simply what the accreditation process is. I'm always here to help. If you have any questions at all about it, please reach out to me and I'll help you along the way.
Thank you so much.
Yeah.
I really appreciate you doing that. You are amazing with handling all the accreditation, especially in the last year. We went from like, I'm probably wrong, but we went from like 34 houses to like what, 150, and you did that. So
yeah,
props to you.
Thanks. And we do support too. So as well as just being on the state registry and the loans, it's like a network. So once you're Walker accredited, we have a network and we're able to learn from each other. And that's one of the things I really love about Walker, is that networking aspect as well. We do in-person events, peer leader trainings and things like that, where we can network and you guys can learn from each other. So it's super important.
Yeah. Well, thank you, Bree. I'm going to jump back in and talk about the level 3 and 4 BHA residential treatment facilities. So in this section, I'm just going to go over the services, requirements, and the licensing and certification process. The BHA requirements are going to be more focused on the services that are provided, while as the RTF requirements are going to be more focused on the facility requirements. And I think like the biggest takeaway from what we're going to talk about is just exposure to these topics and knowing what you're going to have to do on the next steps. It might be a little boring and dense because there's a lot of facts, but it's good to have and start this conversation because this is the types of things that you're going to be talking about and doing as you're deciding or have decided, I want to partner with FCS services or I need to become a BHA. So here we go. Certification standards. Agencies that are certified for residential and inpatient treatment services provide individualized intervention, assessment, and treatment for mental health, substance use, or co-occurring disorders in licensed residential treatment facilities or in hospitals. BHA services. So an agency may choose to provide any of the following individual BHA services under this certification. So you have option 1, low intensive inpatient services, which are like recovery house residential treatment services, long-term residential treatment services, and residential mental health, intensive behavioral health treatment services, voluntary triage. Also option 2, you have like the same essential things, but just more intensive behavioral health services and voluntary triage as well. The BHA requirements, so these are general requirements that apply to all BHAs, inpatient and outpatient, that provide SUD services. And there are some overlap in the requirements, so that's why they kind of just talk about them together. But a governing body, an administrator, set policies and procedures, an individual service plan, record systems, HR, meaning like you have background checks and training for employees. It's not a personal residence when it's like a BHA. And assessment and counseling services provided by substance use disorder professionals, which are called SUDPs, or a trainee, which is a SUDPT, and then a clinical supervisor who is the professional, the SUD professional. Okay. To provide residential treatment for substance use disorders, BHA must have a 24-hour supervision. And then additionally, there are specific requirements for BHA's licensure, which including using ASAM criteria for admission, and then maintaining a list of resources for referrals, and then creating an individual service plan with at least one goal identified by the individual during the initial assessment or first service session. And I have the WAC link is there as well for those requirements. Residential SUD treatment services are required to provide education on the following disorders. So SUD, relapse prevention, bloodborne pathogens, TB, emotional, physical, and sexual abuse, nicotine use disorder, and then the impacts of substance use during pregnancy, the risk to the fetus, and the importance of informing medical practitioners of chemical use during pregnancy. If an agency wants to provide residential or inpatient treatment, they have to meet some of these general requirements that are listed in this WAC 24, section 24 or 246-341. However, agencies certified for residential and inpatient treatment can also offer other services like information, assistance, referral, behavioral health support, assessment, and treatment, as well as outpatient crisis services without needing additional certification. These are the requirements for a behavioral health agency providing recovery house services. So this is specific to recovery housing. The agency must provide SUD residential treatment services with social, vocational, and recreational activities to aid in the individual's recovery. The program must also include relapse prevention, recovery skills development, job training, employment, and other community services. A lot of times people that are going into the recovery house setting might be exiting being incarcerated, might be exiting jail or prison, and they need that extra job training and employment just to help them be able to start having a job again, because that can be difficult. And then also for recovery housing, the agency has to provide, this requirement says that an agency has to provide no less than 5 hours per week of treatment services that are in line with the ASAM level 3.1. And so if you think back to the pages that Melina was talking about, that's like at the bottom of it, that's like the little level that it says there, just to reference when you're going through the toolkit again. But yeah, the agency must conduct and also document monthly reviews of the individual service plan as well. Yeah, so these are recovery housing specific certification requirements to get licensed as a BHA. To get licensed as a BHA or a RTF, you need to submit 2 separate applications, but you can send them in at the same time. Both applications need to include policies and procedures that follow the WAC requirements. How long it takes to get your license, though, is going to depend on how long the construction takes or how good your paperwork is. So it can take time or it can be pretty quick. You'll also need to pay your fees and do background checks for the important people in your organization. And then when you're ready to apply for your BHA license and certification, these are the steps you would follow. Submit your application with policies and procedures, background checks, your fee, then also an ADA checklist. And then a Department of Health reviewer, they're going to check the paperwork and contact you if you need to make any changes. But once those policies and procedures are approved, the DOH reviewer, they'll schedule an on-site visit and they'll come review your personal records and the facility. If your RTF license is granted or ready to be activated, your behavioral health agency license and certification can be activated as well. And then you can find out more about the process and applications on the DOH website. And so the state of Washington has over 100 licensed residential treatment facilities that must meet minimum health and safety standards set by the state law. The DOH inspects these facilities during initial licensing process, and they check them regularly after. This chapter of the WAC 246-337. So this chapter outlines like the minimum health and safety standards for 24-hour residential treatment facilities that are providing healthcare services to people with mental disorders or SUD, whether they're privately owned, county owned, or municipal. And then licensing requirements will differ depending on whether you're applying for an initial license or if you're just renewing or amending it. And I've linked the RTF program manager to contact them if you do need help, because sometimes it's easier just to reach out to someone else than continually trying to find the answer for your own. So want to make sure you have all the resources that you need. And these are just the basic requirements for the residential treatment facility licensure. The governing body, administrator, policies and procedures, individual service plan, record system, HR background checks, training, and then you have to have staff present 24/7. And the Department of Health actually has their own toolkit on residential treatment facilities. If you're interested in that, it's also linked here and in the toolkit. This is a whole nother list of contacts that I gathered for you guys. So if you have questions about licensing and certification process, you have the name and the email. If you have questions about applications and application status, you got number, phone number, everything you need there. Again, the contact to AmeriGroup and FCS, and then contact information for questions about Medicaid, Apple Health, and the medical assistance customer service center. Some great numbers there. And then, as we've pretty much talked about we've kind of already talked about what our role is with you guys. But Walker provides technical assistance to anyone that is interested in recovery residences. The technical assistance that Brianna was talking about earlier with our owners and operators of recovery residences, our webinars that we're doing right now, all just a whole bunch of program support. I don't know if Bree, if you want to add anything. I have your contact information here, because if anyone needs anything from Walker, I'd send them to you.
Yeah. Yeah, no, just reach out. I'm available, and we'd love to help you. It's not just our goal to get homes accredited, but also to educate and to help those new operators who are, have a vision of opening up recovery homes, because it is so needed all throughout Washington. So we're here to help and support in any ways that we can. And yes, we have a bunch of webinars recorded already, so that's a good resource as well that you can dive into.
I guess I must have deleted the thank you or the question slide, but I think it's a great time. We have like 15 minutes left I know a couple people had to leave early. I know Elena had to leave. Looks like, I hope I'm saying your name right. Cameron,
yeah. Do you have any questions, Cameron?
I know you had a couple in the chat, but now that we've got through everything, is there anything else we can answer for you, whether it be Walker or anything? You can unmute if you want, or you can type and we'll just read it.
He says he's having a hard time unmuting. That's okay. If you had a question, you could type it in the chat. We could answer it through chat too, if it's easy enough.
Yeah. But yeah, if you don't have any questions, I just want to say thank you for joining us today. Thank you again to you, Brianna, and Melena, even though she's gone. Thank you for everything today. It's been really great working with everyone. Also, working with our representatives at the Healthcare Authority, especially Heather. Thank you for your support in developing these toolkits. It's been very fun and extensive for me, being the marketing engagement coordinator, but learning all about everything CBHA. It's been very fun for me. I have more knowledge now going over these toolkits very extensively for so long that I think I could probably become an expert in this field now.
Yeah.
But yeah, thank you everyone for your time today.
Thank you. Can you guys hear me now?
Oh, we can hear you
Yes.
now. Hi.
Hi. Sorry, I was just struggling with it.
Okay.
No, this was very good. I think the details and all the links and the resources, I think for somebody like me who's just starting out, is very useful. I love the diagrams, by the way, especially the ones that show you, the level 1, 2, 3, and 4, and which agencies are supporting which ones. I think that's very, I like visual learning, so I think that was very good.
Okay, so thank you. When you are looking in the toolkit, every single one of those boxes has a link too that like takes you to where you need to go to learn more information.
Right.
Yeah, we really try to make that as helpful as possible. So you're just starting out. What are you doing now? Like, what do you have?
So I had a meeting with Brianna and a couple of other people, and just sort of gathering information, trying to make sure that the legal entity that I need to create is in place. Looked at all the application process. So I've had emails with Brianna and other people here. So I'm just kind of going through all the process, making sure that I'm lining it up in the right way so that there aren't
Mhm.
unnecessary delays. And, I have a house that's sitting and I don't have somebody, or I don't have this, or I don't have that. So I'm just kind of working through all of those pieces now. But I'm pretty sure you're going to hear from me.
Yeah.
Well, I think
Cameron,
that's great.
Yeah.
go
Real quick,
ahead.
if you come up with any feedback as you're going through this process, what I'm trying to do coming up is I want to create like a fast facts of like quick things that are just for our accredited providers, like how, like if you want to get FCS, you want to get like a FCS peer services, you have that, how you can get reimbursed really quickly.
Right.
Like I'm trying to
Right.
create a document. So yeah, if you
Yeah.
have any feedback after going through all this,
Yeah.
please share it with me. I would love that. Sorry, Bree, go ahead.
Oh, it's okay. I was just going to say, Cameron, since you are such in the early stages now, it could be a good time just thinking about what partnerships you might want to have in the beginning.
Yes,
It's
that's the other
pretty
amazing thing
hard
about
to
this
just,
presentation. Yeah, that
yeah.
you want to start thinking about who do you want to partner with, because you're
Mhm.
trying to provide something that is more holistic than just to stay at a place.
Yeah.
So there's need for people to be engaged in productive things. And
Mhm.
so yeah, that was a big thing. I'm not trying to become a stage 3 or 4, level
Right.
3 or
Yeah.
4 person. But
Yeah.
even in the stage 2 or level 2, I should say, it is important to know who you can reach out to
Mhm.
for that sort of comprehensive
Yeah.
plan and all the pieces that are needed for somebody to kind of get back on their feet again. So yeah.
Mhm. Okay.
I don't know if you're familiar with I think it's West Sound Treatment Centers. Renita Bolt, I believe is her name. Anyways, she's one of our accredited providers. I think that's the correct housing name. She was on our last installment of this toolkit. And she had said that she actually does have some of those FCS services, like she offers them. And so just thinking, if you want to reach out to someone who is an accredited provider, that'd probably be a really good
I think
contact to ask
this is
her questions.
exactly what I was thinking also, is because I'm in this area. You guys are doing this for people who are in this estate. If I can
Yeah,
hook up with somebody who's gone through the process, I think that may make it a little bit easier for me, just to kind
absolutely.
of leverage. So if there's a name or an email, or if an introduction that you can just kind of do for
Yeah.
me, just kind of loop us the 3 or 4 people in, I would really appreciate that. I think that would be just like a blessing, honestly.
Okay.
Yeah.
Could you put, I know Bree has it, but for me, can you put your email in the chat?
Yeah,
That sounds
I
good.
just
Thank
do
And
that.
Blair, I'll
And
just
you.
correct you because you had her name right, Renita Boyd, but her agency is Caring with Compassion. So I just wanted to.
Thank you. Thank
I
you.
just put my email in the chat.
Okay.
Yeah, Cameron, what area are you looking to like open in so I can see who's close to you?
So I was
Yeah,
thinking
that might be
about
better.
like Burien and South Seattle, that area.
Okay.
And I talked to somebody who's doing it in Pierce County also, but I haven't had a chance to go visit them.
Okay.
So even like, I mean, I'm looking at basically 3 counties, right? King, Pierce, and Snohomish, in those 3 kind of areas. Obviously, King County is too expensive, but maybe in the south part of it and other areas that we can find
Okay.
something.
Sounds good. Yeah, I'll do some thinking and get some names of people so you can connect with. Okay.
I think I've been trying to actually find Renita's email, but we'll talk about that offline.
And Blair, your email is also on the Walker website, right? So if I need to
Yeah,
reach out.
I'll put it
Okay.
in here
No,
for
I'll
you.
find it. It's okay.
You're also gonna get a follow-up email with the slides and a survey. That'll probably be sent from me anyway. So, but it's
Okay.
in there.
Yeah, no, I think, the thing that I'm seeing is that this is all the presentation is giving you the full sort of lay of the land, right? These
Yeah.
are the things that need to happen. These are the links you need to go to do. And then there's this practical side of somebody who's taken all of this and applied, right? And that's where you're just kind of like, sometimes I'm a little overwhelmed, right? It's like, what do I need to do first? Do I need to get a registered agent first, or do I need to get the nonprofit app, or do I need to get a domain name? It's like,
Yeah. Well, hey, if you ever need help with any websites, I'll chat with you offline as well.
Oh, okay, cool. Hey, good to know. See, like when we start talking, there's just so many, things that you find out from people. It's just,
Absolutely.
yeah. No, this is really good. I think so far I've been very, very happy with everything that, I've gotten from Walker and you guys. So really,
Well,
really appreciate it.
thank you.
Imagine trying to do this from like 15 different organizations and agencies. It'd be impossible. So
When I started building this toolkit, I did not even understand or comprehend what I was doing, but I understood how important it was. Actually, hearing you right now say like this is exactly what you needed, like makes all the time and effort that was put into it and all the stress just so
yeah.
worth it. So thank you
Yeah.
for sharing
No,
that.
and this is not like a boring Word document either. I mean, you did graphics, you did colors, you did fonts, you did your smaller fonts. I mean, you did the whole charts, right? It wasn't just like, here you go, read it. Like, who wants to read that, right? Like, and the good thing about this is like, I can skip pieces that I don't need to do, right? Like, I'm not doing FCS.
Absolutely.
I can just like, okay, I may
Yeah.
be just partnering with them. Great. Like, yeah.
Thank you.
Yeah.
Well, I guess we should probably close this up.
Yeah,
Thank you, Cameron. Thank you, Bree, and everybody else. Thank you, Heather, for joining us as well.
Yeah, thank you for having me.
I was glad to have you. We did a lot better this time than yesterday, so
Well,
no internet issues. Voice
you
is
guys did
good.
fine yesterday. It was just that internet was being a bear.
All right. Well, thank you, everybody. I hope everyone
Thank
has a
you.
beautiful rest of the week.
You
You
too.
Take
too.
care. Bye-bye.